Good morning, everyone. Welcome to the podcast of the Kakas International School. Good morning, sir.
Morning.
Happy Doctor's Day.
Thank you.
I'm Mansi Survase from grade 8. I'm very happy to be a host for today's podcast. Before we begin, may I ask, are you ready?
Yes.
Can we start our podcast?
Yes, sure.
Great, thank you. So, sir, can you please introduce yourself and tell us more about your area of specialization? Also, what inspired you to become a doctor?
Okay. My name is Dr. Mohit Kheur. I am a dental specialist. My specialization is actually about replacing teeth with artificial structures. So if you are missing a tooth, then I am the person who will make you a new tooth with either dentures or what is very common nowadays is what is called as dental implants. I do a lot of cosmetic work on your teeth as well. So that is where I work. I divide my time between my own practices. We have one in the main city, one in Nigri. I teach at a college, which I am very passionate about. And I work at a hospital called Dinanath Mangeshkar Hospital also. So that is how I typically divide my time. In terms of how I got motivated to become a doctor is that in my 8th, 9th, 10th standard in school, I was always more fond of biology and life sciences. My teachers were also quite encouraging from what I remember and encouraged me to become a doctor. Plus, each time I used to visit doctors with my parents, I used to quite like the profession that they were involved with. So that is what motivated me to become a doctor. When we were at that point in time when we had to choose our careers, everybody used to choose becoming a MBBS doctor. So like 99% of dentists of those time, I was also one of the people who tried to take admission into an MBBS course. And because I somehow did not manage a government seat, then I got into dentistry. So most of us in those times used to be that way, that you tried to do MBBS. If you did not get admission, then you chose to do BDS, which is the Bachelor of Dental Surgery course. But now I see that the times are different. Now everybody wants to choose dentistry as an option from the beginning itself. So that is quite an encouraging change. Yeah. Okay.
Thank you, sir. So let's begin. My first question is, what are common health issues you see nowadays?
Well, as a dental specialist, I can talk with authority and conviction on what I see myself. Most common issues that I see nowadays are related to not very good hygiene that patients maintain. Hygienes and habits. These are the two things that are the cause of a lot of problems that I see. Habits in terms of eating habits, in terms of tooth teeth cleaning habits, in terms of daily lifestyle habits. These are the things that cause problems that I see in dentistry and that I see in other medical fields also. We have gone on to becoming people who are more driven by social media, lifestyle, fast food, a very lifestyle that requires us to do too much in too less time with very less rest, very less time for exercise, very less time for a hobby and things like that. So all these things contribute to illnesses. I see a lot of those in patients' mouths, but I know from everything else that a lot of other illnesses of the body, whether it is the heart, the eyes, the lungs, all these organs get affected to a large extent when we are a victim of bad habits that we develop. So, so
That's a fascinating point of view. Moving forward, now my next question is on technology. As we all know, technology is taking jobs of many people. So, how has technology changed healthcare over the years?
technology over the years has made healthcare today unrecognizable from what it was before. And if you are a doctor who keeps pace with technology, then you are a doctor who survives in this field, because technology in our science helps you at every level of treatment of the patient. So when a patient comes to us with a problem, you need technology, number one, in diagnosing the problem. So earlier we used to just diagnose with our hands and with our eyes. Now we have very sophisticated X-rays, sophisticated scans, and so many other techniques without getting into the technicalities, which help us diagnose. In when we are treating a patient, also earlier treatments used to take a long time. They used to be painful. Patients used to have to come again and again and again for treatment. But now with technology, treatment has become easier, it has become more patient friendly, it has become painless, it has become faster, and overall treatment quality has also improved. So at every point in time of treatment of a patient, modern technology is being implemented, and because the technology keeps changing, as a doctor you cannot be giving your patient treatment today based on technology that was there 5 years ago. That is wrong. So, as a doctor, one of the important things you have to do is keep upgrading yourself so that you are in touch with the latest technology. The days are gone when you opened a dental or any practice and then you sat just like that for many, many years. That cannot happen nowadays because you have to keep pace with technology.
That's great. So my next question is, how did you treated your first patient? What was your experience? How did you feel at that time?
Oh, my first patient. So typically, when you are in medical or dental college, you are given your first patients to treat in the second or in the third year. Till then, you are just seeing your seniors and your teachers treat patients, and you are just studying the theory. So treating any first patient is obviously a very important milestone in any young doctor's, you know, in any young doctor's career. So I remember one of my first patients I treated was probably in the year 1992, 93 or something like that. And it was a patient who came to me with some pain in some tooth because he had a big cavity there. So I was supposed to give him an injection and then subsequently treat the problem. So yes, I had very good teachers next to me who used to hold our hand while we used to give an injection in someone's mouth, because you are scared, but you cannot show that to the patient. And in my field, the patient is always 10 times more scared than what you think, because it is not a pleasant experience for anyone to be getting an injection in their mouth. So my teachers were there to help me. My seniors were also there to help me along with it. So I can say and I can remember very well that the procedure went off very smoothly. But yes, that was how I treated one of my first patients. And gradually you learn to treat patients with more confidence using different types of technologies. So the first patient is always a challenge and is always a more memorable patient, so as to speak. Yeah.
Thank you so much, sir. Now my friend will continue further.
Hello, sir. Happy Doctor's Day. I
Thank
am
you.
Advaita Gupta from Grade 8. Today I am very excited to learn about the medical profession, healthy living, and what it takes to become a doctor. So, may I start?
Yeah.
Thank you. So, what challenges did you face while you were studying?
Personally, if you see, when I was studying, I am from Pune, I was studying in Bombay, so that was a little bit of a challenge for me. Uh, but yeah, I was not so far. I used to have batchmates who used to come from all over the country, so they used to be a little homesick initially, and then gradually everybody got used to it. Otherwise, in terms of challenge, I was in a government college. So, in terms of facilities, we had limited facilities. But the big important thing was that we had very, very good teachers and we had a lot of patients with whom we could work and study and, learn our subjects. So otherwise, in terms of challenges, not really much. The only thing I can remember is that being away from home was a little bit of a challenge. And otherwise, nothing else. Otherwise, it has been a very enjoyable learning for me. Yeah.
Yes, I can understand. My next question is, if you had an option to change your profession, would you change it?
No, not at all. Not at
As
all. I'm very
you
happy.
love your
Yeah, yeah, absolutely, absolutely.
So, thank you so much, sir, for taking the time to speak with us. Have a great day and once more, happy Doctor's Day.
Thank you so much. Thank you.